For all of you who consume content in different ways, I'm going to take you through the healthcare crisis, medical terrorism, whatever you choose to call it. This is going to be based off the New York Times. So there is no agenda that I'm trying to bring. This is literally printed right here for you to read. Do you remember when doctors had to choose who to ventilate during COVID? Because I remember that. And I'll do you one better, because you see, they're trying to make these decisions between children undergoing amputations, brain surgeries without anesthesia, or even clean water to clean wounds. I understand Gaza's used to this, but this is an entire new level because they can't even replenish their supplies. They can't even replenish their body for sleep, for even simply eating. Some of them risk the fear of going home and dying. There's others who have been on shifts looking amongst the corpses, the bodies, the carnage that comes in, wondering if it's their children because it's their neighborhood that was targeted. The ambulance drivers are just trying to chase the sounds of where a bomb happened because guess what? The power was cut off again for the third time. Solar panels have also been destroyed in Shifa Hospital, so they are running on literally limited electricity. They've had to close an OR suite. So the irony is you're actually seeing more and more patients coming in and less resources. 4 hospitals were attacked this weekend, and they are literally running on a deficit. As are the medical team. See, only able to eat maybe one meal. I have fasted before while working in the hospital. It's doable because you're able to keep your mind busy, but you know what happens? You're able to actually open that fast and you're able to go home and sleep. They cannot do this. They cannot do this. And this is literally cruelty to inflict this upon healthcare workers. This is medical terrorism. Right now, with nothing to power air conditioners, doctors have reported the heat has gotten bad enough to make patients' wounds fester. They're also not able to appropriately dress them either, so they are reporting of actually seeing maggots in wounds. Nope, I'm not making that up. Maggots nibbling at patients' charred and torn flesh. With more than 2/3 of the hospitals down, and this is what the pediatric cancer unit has become, you can understand why I call this medical terrorism.